A patient walks in with vague chest pain. The X-ray looks almost normal until you notice a shadow behind the heart. Is it benign or something aggressive? This patient with a paravertebral chest mass often presents with symptoms that are non-specific and develop slowly, often only appearing once the tumor is large enough to compress adjacent nerves, spinal structures, or the lung. While many are asymptomatic and found incidentally on imaging. Clinical manifestations vary depending on the underlying pathology, which includes neurogenic tumors, most common, infections, or extramedullary hematopoiesis. You order a CT scan. Now the truth begins to unfold. A well-defined mass in the posterior mediastinum. No obvious invasion, but something feels off. This is where radiology becomes detective work. Core teaching, DD flow. Most posterior mediastinal masses are neurogenic tumors. But here's the challenge, you must differentiate between them. Schwannoma, most common in adults. Well circumscribed. May show cystic degeneration. Neural foramina widening. Think, benign, slow, but can mimic others. Neurofibroma. Target sign, MRI. Associated with NF1. Less encapsulated. The key clue? Association with systemic disease. Ganglioneuroma. Occurs in young adults. Well-defined, homogeneous. May show calcifications. Mature, calm, almost silent tumor. Neuroblastoma, red flag. Seen in children. Irregular, aggressive. Calcifications plus invasion. This is the one you must never miss. Ganglioneuroblastoma. Intermediate features. Mixed behavior. Lives between benign and malignant worlds. Clinical insight moment. One imaging feature can change everything. Age of the patient. Margins of the lesion. Bone or foraminal involvement. Radiology is not just images, it's pattern recognition. Next time you see a posterior mediastinal mass, ask yourself, is it calm or aggressive? Is it mature or primitive? Because one decision can change the patient's life. In this smart art, we found that most of posterior mediastinal masses are neurogenic tumors, which are as follow. Schwannoma, which occurs in adult and shows well-defined edges with cystic changes and maybe calcification. While the second one is neurofibroma, which is usually associated with neurofibromatosis type I, it appears less encapsulated with target sign on MRI. The third one is ganglioneuroma, which occurs in young adults with well-defined edge, homogeneous pattern, and may shows calcification. The fourth one, which is the red flag for this group of diseases, is neuroblastoma, which occurs in children and appears ill-defined with heterogeneous and invasion pattern in addition to calcification. Lastly, is ganglioneuroblastoma, is with intermediate features, mixed behavior. It lives between benign and malignant worlds.